Good afternoon, boa tarde, bem-vindos. Welcome to this conversation about the new coronavirus pandemic and Amazonia's future. My name is João Bill. I teach medical anthropology here at Princeton University, where I also co-direct the Global Health Program and direct the Brazil Lab at the Princeton Institute for International and Regional Studies, which is hosting this event. We are grateful to the Princeton Environmental Institute, the Center for Health and Well-Being, the Program in Latin American Studies, and the Instituto de Estudos para Políticas de Saúde for their co-sponsorship. The coronavirus pandemic has significantly altered our life worlds, revealing the precariousness of our systems of preparedness and public health response, as well as deeply entrenched inequalities that are expressed in vulnerability and disparities of care. Like never before, we are faced with a world of uncertainty as economies crumble and state capacities are pushed to the limit. While democracies erode, the pandemic has also been dangerously politicized in increasingly authoritarian regimes. As of this morning, there are 2.5 million confirmed COVID-19 cases globally. Here in the United States, the epicenter of the pandemic now, deaths amount to 45,000. Meanwhile, the pandemic is starting to peak in Brazil. As of today, the country has 43,000 cases and 2,700 deaths reported. The pandemic is also hitting hard in the Amazonian region, which is key to planetary survival. As we know, the Amazon is the world's largest and most diverse tropical forest and the ancestral home of over 1 million indigenous peoples. Brazil contains about 60% of the rainforest, which is a massive carbon sink undergoing systematic destruction, especially under President Jair Bolsonaro. The city of Manaus is experiencing a total breakdown of public health services at this very time. Over 100 people have already died there, many at home, many buried in common graves, and many more unaccounted for as elsewhere in the region, plagued by violence and generalized precarity. There are already 34 COVID-19 cases among indigenous peoples in rural areas and 3 deaths. We are here today with a stellar group of scholars and innovators to think about Amazonia's plight in this dire moment on Earth Day. We look forward to their insights on what is happening on the ground, how deforestation might lead to the emergence of new diseases, and how they see Amazonia's future post-COVID-19. Let me introduce our wonderful panelists. Marcia Castro, who earned her PhD at Princeton, is the Andelot Professor of Demography and Chair of the Department of Global Health and Population at Harvard's Chan School of Public Health. Ilona Sabah, a renowned civic entrepreneur, is the co-founder and executive director of Igarapé, a leading think and do tank on security, climate, and development issues in the Global South. Pedro Vasconcelos is the director of Brazil's National Institute of Science and Technology for Viral Hemorrhagic Fevers at the Evandro Chagas Institute. Also a professor of pathology at the State University of Pará, he studies arboviruses and hantaviruses in the Pan-Amazonian region and has played a key role in our understanding of the transmission of Zika. Beto Verissimo is a leading environmentalist and senior researcher at the nonprofit Amazon. He's currently overseeing the project Amazonia 2030 that explores conservation and economic leapfrogging initiatives for the region. Let's give them our warmest welcome. Thank you for being online with us. Our format today is the following. I will ask a first set of questions to Marcia, Ilona, Pedro, and Beto in this order. Our speakers will then build on each other's comments and discuss among themselves. We will conclude with a final set of questions to our panelists on their vision of what might be possible in policy, science, and economics to guarantee the survival and sustainable development of this vital region and its peoples. So let's begin with Professor Marcia Castro. Marcia, how do you see the current impact of COVID-19 in the Amazon? We know that other tropical diseases plague the poorest in this under-resourced region. How are the urban poor, riverbank and settler communities, and especially indigenous peoples being affected? And what are the responses available?
So first of all, thank you, João, and thank you, the Princeton Lab, for organizing this event on Earth Day. And Earth Day is turning 50 years. So I wish we could all be here talking about the Amazon with much better news. I don't think we have that good news to talk about, but still, I think it's important to have this discussion. So you gave the numbers about coronavirus in Brazil, and it's not surprising to see that the largest number of cases and deaths are observed in São Paulo, which is the state with the largest population, and therefore it's just a matter of sheer number of people. However, if we take those numbers and we create indicators and we see the number of cases and the number of deaths per 100,000 people, then the number one state is Amazonas for both indicators. It's not São Paulo anymore. And the second state in terms of cases per 100,000 people is Amapá, another state in the Amazon region. So the rank of states flips significantly when we look at rates, when we consider the population exposed to the risk. Now, it's important to consider that Manaus, the capital of Amazonas state, is facing what I think we should start calling a humanitarian crisis. The demand for hospital beds is at or above capacity in most hospitals in the city. Some hospitals don't have enough ventilators or enough protective gear for the health personnel working in those areas. So I think it begs the question, why is that the case? And I want to elaborate on 4 different points here. So the first point relates to the beds in the hospitals per se. So if we look at the number of hospital beds per 1,000 people, a very common indicator that we look in health systems, the lowest numbers in Brazil are in the Amazon region. And when we look at individual states, the first one with the lowest number of beds per 1,000 people is Amapá, and the second one is Amazonas. So we start seeing a pattern here. When we look at this scenario for ICU beds, it's not much different. The worst is Amapá, and Amazonas is the 4th worst in those indicators. The second point is about another very common indicator in health systems, which is the number of physicians per 1,000 people. And again, when we look at this indicator for Brazil, it is exactly in the Amazon region where those numbers are the smallest. And if we look by individual states, again, Amapá has the lowest number, and Amazonas has the 3rd lowest number. So not enough beds, not enough personnel. The third point is, if we look at the list of recommendations from the Ministry of Health on different things that people can do to protect themselves against coronavirus, the very first item in this list is wash your hands with soap for 20 seconds. It's very simple, but you need to have access to water to be able to do that. So again, if we look at the Amazon region, 43% of the population living in the Amazon do not have access to water. In Amapá, one of those states that I mentioned, this number is 65%. So we're talking about a fraction of the population that cannot do the simplest action to protect themselves, which is to wash their hands. The fourth thing I want to bring to this discussion is a measure of inequality. So if we look at the Gini coefficient, it's a very common measure to see income inequality in countries, and Brazil has a history of being usually among the top 10 most unequal countries in the world. So if we look at this indicator by states in Brazil, the state that has the highest, which means the worst, income inequality is Amazonas. The number 2 is Amapá. tied with Acre, another state in the Amazon region, and Alagoas, a state in the Northeast. So this inequality, and that's what's important to think about, is connected to poor housing, is connected to crowded households. So again, if you think about isolation, right? It's connected to informal activity in the labor market. And for some of those people, you are not even in the registry in Brazil that entitles you to receive a cash transfer program. So not only you are vulnerable, you're invisible to social programs, and you're not going to be covered by this new legislation passed in Brazil that will give a special pension for people because of the isolation. So we're really talking about a scenario that poses major barriers for the most, the fraction of the population that are worse off in terms of socioeconomic conditions. Now, all of this is happening in an area that concentrates 99% of malaria in Brazil. That's basically where malaria happens, which is directly affected by deforestation, by the patterns of gold mining that we see in Brazil and in the neighbor countries, all in the Amazon region, and by the patterns of exploitation activities of other resources, and also of human mobility. That is a lot connected to the exploitation activities, gold mining that happen in the area. Now, in addition, if we think about the fast urban growth that is happening in the Amazon, and mostly not really connected with access to infrastructure, and I mentioned the water before, we're basically creating ideal conditions for Aedes aegypti, which is probably the most important vector for arboviruses. And the number of municipalities that record dengue, for example, every year is increasing dramatically over the past decade. And right now, as we speak, there is an outbreak of dengue in Acre, which is the westernmost state in the Amazon region. So basically what we see is a scenario of inequality, disease burden that really facilitates this virus to thrive. And if you put on top of this the lack of resources to perform testing, to be able to trace people that had contact with those that were positive, we really see a devastating scenario of humanitarian crisis already in some states, and most likely to happen in other places. And to conclude this initial intervention, what I want to highlight is the virus itself does not discriminate by race, by income, by the type of house you live in, but it does expose local inequalities in places. And it's happening in Brazil. It's happening here in the US, where some cities have 30% of the population that is African American, but 70% of people who are dying are African American. So again, the disease does not discriminate anybody by socioeconomic status, but it will expose inequalities intrinsic to the local populations.
Thank you, Marcia, for this sobering and difficult, panorama that you shared with us, which really highlights key issues that we want to keep addressing in our conversation today. Let me now ask a question to Ilona Swabo, and always saying that the panelists should feel free to intervene and to build up on each other's comments after this first round of conversation. In a recent article, Ilona, that you co-wrote with colleagues from Amazon, you speak of COVID-19 as an unprecedented, acute and chronic problem, really well and powerfully described by Marcia just a few minutes ago. That is, the pandemic is having devastating immediate effects on the most vulnerable's lives, in the region's economy, and it unfolds at a time in which the chronic destruction of the rainforest has dramatically accelerated. Which kind of political maneuverings are underlying the response to the pandemic, and which kind of actions that harm the environment are taking place in the meantime, as all this is taking front page of the media and of public attention?
So thank you very much for the invitation to join this event, João Miqueias. It's a great pleasure to be back at virtually at the Brazil Lab. I think it's such an honor to be with this distinguished group. And Marcia, you just touched so many issues that I think we need to unpack in these discussions. They're really, really important. But I've been asked to reflect on this various legal, illegal, and political moves to exploit the Amazon at a time of COVID. So to start, I would say there are several reasons why we should worry about the Amazon in the midst of this crisis. In fact, I think we should worry even more. We need to deal with these two simultaneous crises in Brazil, this acute one, which is to control the pandemic, but also the chronic one, which is to stop the accelerated destruction of the Amazon forest. And we know that to make matters worse, the crises are compounded by political chaos that has been growing in the country. And if it was not bad enough, we'll possibly face the worst economic downturn in a generation, just about to, I think, already started. So the first point I want to make is that it's important that we acknowledge that the considerable costs of the pandemic are small when compared to the devastating and permanent effects that our children and grandchildren will face with a warming planet and extreme weather events. So as all of you know, the effects of climate change are not limited to loss of lives, livelihoods, massive migration, violence, and conflict. They will also increase the risk of new epidemics, pandemics, and I believe Pedro will speak about these issues in more detail. So my second point is about the urgent need to protect the indigenous population. Marcia already touched about the situation in the northern states, but also other traditional people of the Amazon, but not only from contracting COVID. At this moment, they also need to be protected against security threats against them. So traditional populations are extremely vulnerable to the virus, but they're also being targeted by land grabbers, illegal loggers, miners, and other criminal groups. And this leads me to my third point. So we all know that the protection of the Amazon is crucial to mitigate climate change. And this is what makes, I think, the latest data that Beto will comment on from DETER, this alert system that detects deforestation in real time, so unsettling. So criminal groups are taking advantage of COVID-19 crisis to destroy the Amazon. Between January and March, we had the highest clearing since 2015. So these findings show that we are moving further away from our goal of zero illegal deforestation by 2030 that was set out by the Paris Agreement. And we're likely to miss the first climate target set for this year. And for me, this is extremely worrying. We know that delivering on the Paris Agreement is so critical. And despite these 3 points I raised, the federal government is unwilling to defend the Paris Agreement, to reduce deforestation, or to protect the indigenous groups. So the government's narrative is that it's impossible to reconcile the protection of the Amazon with the imperative of development. I think we all here would disagree with that. So we have also seen the government dismantle protection agencies such as IBAMA and FUNAI. I think we all remember the promotion of illegal activities in the region. The episode of the Day of the Fire last August was very, very, I think, critical for all of us, and also the support for these uncontrolled wildcat miners in indigenous lands. So as if this was not enough, at the moment, there is also a push from the president and his allies to approve amnesties in Congress that for me and for many, they are actually rewards for those who invaded and deforested public land. So for example, there's a provisional measure number 910, which authorizes public areas invaded after 2011 to be registered without bidding, including those illegally deforested. So land grabbers would pay whimsical amount that can be as low as 2% of what is charged in the market land market price. So this would not only be a great prize for criminal land grabbers who simply rob public land, but it also encourages new invasions with the expectations that other amnesties could be granted in the future. So for the moment, it seems that there is an agreement that this provisional measure would not go to voting, would expire, but we still have 1 month to go until we are sure about that. So we need to watch that very closely. That would be have like devastating effects. And we all know land grabbing is a crime, very badly defined in the penal code, in my opinion. But many people don't fully realize that it's also often associated with other crimes, such as fraud, corruption, money laundering, drugs, guns, human and wildlife trafficking, and even murder. So even if this provisional measure 910 expires, the president and his allies in Congress will not give up. So I believe we need to act. And to do that, we took I would say the challenge to launch an initiative to track environmental crime. This means we're assessing the size and scale of these crimes and the leakages between legal, irregular, and illegal activities in the region. These are very slippery categories. We believe also we need to measure the direct environmental harms as well as the indirect social and criminal consequences of these activities. So we developed a typology to do precisely this. It's being peer reviewed right now. So if any of you are interested to see an advanced copy, just please send me an email and I'll be glad to share. And what it will do, it will just provide a comprehensive overview of the many dimensions of environmental crime. So at this stage, it features 5 categories with 17 separate activities. We are focused on forest and land use, energy and mining, ecosystems and wildlife, transportation and built environment, and pollution and waste. So we'll be using a combination of remote sensing together with survey data and field research to map the distribution of environmental crime in Brazil, Colombia, and Peru to start. We're also reviewing legislation on what classified as environmental crime in these same countries. What happens is that different countries use different definitions, and this limits the protection of the forest. So we need better coordination, and we need also to harmonize laws and procedures across the region if we want to protect the forest. And I think if we're going to deliver on the Amazon 4.0 vision that Professor Carlos Nobre just has inspired all of us with, we absolutely need to guarantee the rule of law in the region. And this means recognizing that not only environmental crimes are linked to organized crime, but also environmental crime can be linked to legal activities. So I'll stop here and leave some concrete ideas on what can be done for our conversation. Thank you, and happy Earth Day for everybody.
Yeah. Thank you, Ilona. This so complementing the bleak panorama that Marcia painted for us from the beginning, showing the humanitarian toll of COVID-19 in the region, which is maximized by historical inequalities, infrastructural decay or precariousness. There's this issue of this ongoing environmental crime and the destruction of the rainforest, in course, supported in many quarters of the federal government as well, and dismantling of surveillance and accountability mechanisms. So to add one more perspective to this complex scenario, we are delighted to have with us Professor Pedro Vasconcelos. And over the year, Pedro, you and your team have identified over 20 arboviruses in Amazonia. We know that you are deeply concerned with the relationship between the advance of deforestation that Ilona was just talking about and the transmission of infectious diseases that Marcia was speaking about. So scientists studying the origins of COVID-19 have been stressing the importance of protecting wildlife habitats as a way of limiting microbes crossover into humans. So how do you see the possibility of the emergence of new diseases given the current rate of destruction of the rainforest?
Well, thank you, João, for the invitation to this superb seminar. Yes, we are presently, we are too worried because the Amazon region has all condition to become a hotspot for emergence of new viruses with potential to cause epidemics and other situations, not locally, but also to spread for different regions and countries, eventually to continents. It's important to remember that arboviruses are in general focal. They live in natural cycles involving macrophages, insects, arthropods, and vertebrate hosts. And these viruses are biologically transmitted for different animals. And in general, but not necessarily, humans are tangential infected. It's not the preferable host for this virus. Only when the virus adapted to urban areas, you have several examples of that occurred here in Amazon, around the world. For example, dengue, chikungunya, Zika, onion, Ross River, and others, several other Japanese encephalitis, West Nile. They are associated with human as the main host. The vertebrate host become the humans, and the infections through the area become episodic, and epidemics or pandemics will be reported, depends on the arthropod vectors. Of course, that's any kind of action or activities in the Amazon region will be associated with some change in the behavior of the human population to receive these infections. You know, have several kind of different viruses that are example of emergency of this virus, or emergency, like yellow fever recently that occurred in southeast Brazil, due the activities in the rainforest, in the Amazon ecosystem. This is stable, but at the same time unstable ecosystem is fragile, and any kind of modifications like deforestation, highway construction, hydroelectric dam, colonization, is farming, mining, are associated with emergence of the virus. And this virus can, if adapted to urban mosquitoes, therefore urban vectors, they can become epidemic and cause different kind of disease that are associated with arbovirus. It is important to remember that this scenario can result in different kind of clinical presentation, even asymptomatic, even mild disease, moderate severe disease, including encephalitis, hemorrhagic fevers, and chronic arthralgia with fever and rash disease that can left the people with different situation, including death. So it's important to preserve the Amazon region. This is, I am too worried now, because that we are seeing is that an increase in the deforestation, increase in human intruding the forest, and the consequences of this certainly will be the emergence of new virus or emergence of epidemics of no virus that are circulating here. To initiate this, I think this is my first comments. Thank you.
Great.
again,
No, thank you so much for your important work, Professor Vasconcelos, and for this very illuminating presentation of the correlation here of the emergence of new diseases with patterns of deforestation. And Beto Verissimo, we are great admirers of your work and your vision. And tell us a little bit of, if you can share some of the latest data on deforestation, that Amazon or other agencies in Brazil have produced and that Ilona was referring to, and also reflect on how the current health crisis reveals the region's highly unequal and problematic social progress levels. That's something that Marcia had alluded to in her first set of comments.
Thanks, João. I think before the coronavirus crisis began in the region, we already have environmental crisis. Just to keep it the same page, we already lost 20% of the rainforest, and another 20% we estimated has been degraded, meaning areas with logging and forest fires. So on top of the problem that Marcia laid out very clear in the first presentation, we haven't as the coronavirus crisis started in Brazil. In March, only March in the Brazilian Amazonia, deforestation moves up 279% compared to the March of 2019. So forest degradation is another key indicator. Just look at the last 9 months. We are got up 700%. What means forest degradation? It means Brazil actually is contracting future deforestation, because deforestation is a process that starts with illegal logging and forest fires, and then later on we get to the point to convert those forests to open areas. So we are in a precedented crisis here, because we got the whole combination of the environmental under attack, the poverty and the inequality, and the very low level of urban development in the region, and the political crisis on top of that, because the really current government really have an agenda that really is, in a sense, increase the problem. And I think my final comments and point that I want to bring is that we have to remind that the dry season is coming. It's dry season in the Amazon will start July. Forest fires might be another big problem for the summer. And then imagining the forest fire as a health problem, because it's really affect respiratory and put pressure on the health system that are already under tremendous stress. It's not only in the Brazilian Amazon. The forest fire actually spread to the rest of the country. So I'm very, very concerned about, and I think the destroyers of the forest has been very active. They are not worried about the coronavirus. When the enforcement agents are not actually so present in the field, and people pay attention, maybe of course for the health problem. And I think we are in a very difficult moment, and I think this conversation about health and forest conservation, forest as a very unique moment to us to discuss, because I think in the past we never had such kind of crisis that combined those environmental and the health crisis in the same territory and the same moment.
Great. No, thank you, Beto. And I wonder, Marcia, if you want to come back and to engage some of the comments that the other participants made, and relating, this humanitarian crisis that you pointed out, which is linked, to a very precarious, very barely hanging on, health system on the ground, and how that relates, with this new diseases that might be emergent and related to deforestation. You yourself are a malaria specialist. If you want to make some connections with what Beto and Professor Vasconcelos were just mentioning.
Mm-hmm. Yeah, so the first thing I just want to immediately follow up what Beto mentioned, and we have one study that was published recently that looked, it was done here in the US, and it basically showed that people that are exposed to high levels of PM 2.5, they actually have more severe coronavirus infections because, again, it's respiratory. So if we link the virus is spreading and the season of the fires coming, it's, you know, we're just adding more factors to make the situation even worse. So that's one point. The other point is what Professor Vasconcelos mentioned is, I mean, he basically provided a very clear picture of the danger of having new zoonoses emerging, and that's a very clear danger, actually. And I want to mention one thing about this. The danger is there. There is a lot of neglect coming from higher levels, but I think one of the beautiful things about Brazil is how resilient the people are, but how resilient the researchers are. And we saw this during Zika, where a lot of, if not most of the high level production of knowledge of a disease nobody even knew the name before it started was done in Brazil, although the international community like to say that most of the science came from the CDC and whatever, but it actually came from Brazil. And there was a phenomenal editorial in Nature highlighting this. And we are seeing this again. I mean, the amount of collaboration that we're seeing in Brazil and beyond in trying to address this new infection is phenomenal. And I am certain that if we do have a new zoonosis emerging in the Amazon, we're going to see again researchers, scientists in Brazil getting resources, who knows where, because it's not coming from the federal level, but trying to address the problem, trying to produce the highest level scientific knowledge to be able to address the disease. So you can only imagine how beautiful it could be if actually science was valued and if researchers receive the support they need to be able to advance knowledge.
Now, along those lines, you know, Professor Vasconcelos, we know, as Marcia said, that science is under attack in so many fronts, you know, worldwide, but also in Brazil, big time on the ways the COVID-19 has been addressed. So, which difficulties you actually see that you and your colleagues are facing in advancing these important studies that you are undertaking, and which kind of collaborations are taking place, or you think might be able to take place, that could advance this further to bring this to the forefront of conservation conversations? The question, as Beto was also, and Ilona was emphasizing, the question of emerging diseases related to deforestation.
Well, thank you, João, for the question. It is difficult to do research in Amazon. Of course, the difficulties are tremendous due to the financial support, localization of the Amazon that is far from the main academic and scientific centers in Brazil, in Rio, São Paulo, more than 3,000 kilometers from São Paulo and Rio to Belém, and 2,200 kilometers from Brasilia, for example. That is the center of powers. So, of course, it is a challenge. And for this, we needed to look for financial support. This is a problem, but we have obtained success in to have this financial support. And of course, collaboration is essential. And the multidisciplinary and multi-institutional research has supported this. We have a collaboration with several institutions, Institut Pasteur in Paris, Southampton University in UK, Columbia in New York, Yale in New Haven, and, for example, in Texas, University of Texas, where I spent part of my PhD and my postdoc. So collaboration is essential to have success in this, because the Amazon, the the ecosystems is terrible to work. The difficulties are tremendous. To obtain the biological samples for these animals and arthropod vectors to carry out the research are not easy to obtain. Sometimes it's difficult in different stages, and you need to move in by boats or in terrible highways, but we have obtained a success. And of course, the challenge is to maintain this, the renewal of our team. And this also you have obtained, for example, when I became a scientist of Evandro Chagas Institute, working on arbovirus, just 3 research. Now we have around 20 different scientists working. So this is guaranteed. So the financial support to have good equipments, lab equipments, is essential also, because to do cutting-edge research, it's necessary to update all the time in the equipments and so on. So software and so on. It's not easy, but you have obtained some success in this to do that. So, but my word actually is to understand the situation of the different epidemics together with the pandemic. This is it's I think the most important challenge at this moment, because the COVID is spreading, as Dr. Castro has shown. The several states are not easy situation to give support to the sick people. And together with this, we have several other epidemics that are occurring together, ongoing, and the co-infections is a problem that can be investigated, because we have actually flu seasonal, we have a dengue season, chikungunya, measles, that's a large epidemic occurring in Brazil, and several other problems that facilitate the infection, facilitate the disease, and facilitate increasing the case fatality rate and the mortality. Brazil has an important number of case fatality rates, and this is worthy, because the inequalities that presently we observe, especially here in the Amazon region, is terrible. So it's of concern that we are living this epidemic presently. And presently, I am the president of Brazilian Society of Tropical Medicine, and our society is worried with this situation. We became more worried after the change of the Ministry of Health, because the new ministry are only now becoming taking place of this situation in the country, and these epidemics and the pandemic of COVID-19.
Yeah, no, thank you. This is so important. It's really as the point that you're making, right? Some of the arguments we always make in medical anthropology, that disease is never just one thing, right? It's many things. And as Marcia and Ilona and yourself and Beth were mentioning, how historical inequalities play themselves out and creating different patterns of vulnerability. And then the question of the political body, how it responds or does not respond, and the difference that makes, And these were some of the comments that Ilona was making. And today, in an article published in Folha de São Paulo, Ilona, you mentioned the importance both of the nation state and of local administrations in tackling COVID-19. So, but you also make the important point that it's not the private sector, but mainly public institutions that are playing like a dominant role, if they're playing a role, right, rather than playing disregard, right, in trying to keep things under control. So could you tell us a little bit more about the point that Professor Vasconcelos just raised about the pandemonium, and some people are saying the mess within the federal government in addressing this, the diverging messages coming from the former minister to who was now fired by the president, and now we have this vacuum in the sense of guidelines, clear guidelines of how to safeguard populations, communities, and protect themselves from COVID-19. So if you could tell us a little bit more about the political body, both at a national level, how it's operating, but also at the local level, but also this tension between the public and private interests in the management of the pandemic.
Yeah, I think we have, I mean, in the midst of the crisis, we always need to look for the opportunities. And since we are all very worried of what to do, I think first we have to call attention for what can come next. So what Professor Pedro just laid out in terms of not only the co-infections, but the possibility of new arbovirus and new pandemics coming, and how this is aggravated with the destruction of the forest. I think we have the obligation, the responsibility to communicate that very clearly. I know it's very difficult to make different themes come true during a pandemic, because everyone is really, really worried about their lives and their livelihood. But the protection of the forest here, not only the Amazon, but we're talking about the Amazon, is key for us to avoid next ones. And I think when it comes to the protection of the forest, and the data that it's so worrying, and so I think almost, to be honest, depressing what Beto brings us. We need to recognize that this is not a technical crisis. We are facing a failure of governance. We have the satellites, the technologies, the best scientists in the world. They all agree. So we're lacking political willingness. And in Brazil, this is aggravated because we have this, I would say, dispute between federal level and local level, like state level and municipalities, trying to do their best to both protect lives and livelihoods, but coming really in shock with, I would say, a very irresponsible and populist approach to like how to say, thinking that economy will survive if people don't survive. And also not understanding, I think then this brings very beautifully the opportunity of stressing inequality. Because if we don't understand with this crisis that we can't leave people behind, this is our chance, reboot, reset, understand, because we are not safe. This is very clear in my area, because when I always talk about public versus private security, for example, I always try to explain that we are not safe unless everyone is safe. And we can leave that when you go to developed countries. But in countries that are like ours, like Brazil, we think that because we have more resources, we're protected. And COVID-19 comes to say, you're wrong, because the pandemics is contagious. You can have like better underlying health conditions, but you're also at risk. Of course, there are people that are much more vulnerable, but that doesn't save us all, because we're all here now in lockdowns and in isolation. And of course, we need to look for the vulnerable first, but everyone is suffering at some degree with the crisis. So I believe this is a key opportunity for us to understand public good. What are the public commons? What are the commons? What means to protect our, I would say, joint assets in this world? And for sure, public health is one, but climate change and the forests, have to be seen as another one. And I believe that we will work very hard to communicate all this. But I think this is a chance we have to reset our way of life, our way of choosing our leadership. I think citizens are really, really responsible now to understand how their choices are so key to the world, I mean, to what we want to see in the world.
Beto, following that, maybe tell us a little bit more. You already mentioned that in your first intervention, and if you could build a little bit on the points that Marcia and Pedro and Ilona made about how to bring the question of health to bear on the work of conservation and sustainable development in the Amazon, right? And you worked very closely on the question of indices of social progress, which are the poorest, in the region compared to the rest of Brazil. But now with this combination of the humanitarian crisis, emergent diseases, not to mention the political economic crisis, how to maximize this perspective on health within an agenda for a sustainable development in the Amazon.
I think people like Marcia and Professor Vasconcelos has been already say and before, and there was pioneers, people that tell us the critical point of the consequence of destroying the rainforest in terms of health problems. And I think in the past, people look at the destruction of the rainforest in two major dimensions: dimension of biodiversity loss and the climate change. And I think right now, on the top of those two, we got the health. And the health is not on the local consequence, but at the global level consequence of a new pandemic can come from the region, whereas deforestation is absolutely out of control. And the region has this combination of very low development, economic development, high level of destruction of rainforests, and very, very low social indicators. That's Marcia explained very clear about the critical infrastructure of health, and she mentioned about Amazonas and Amapá and Acre, and you can go on because all the states are on the way to get the same problem. So I think the health dimension have to be put in a big perspective, and I need more interdisciplinary work for us to understand much better. And also to communicate in a more articulate way. And I think this seminar here has been able, very important that we have a strong message for this conversation right now. Because if you lose the Amazonia, if you go to the beyond the tipping point, the consequence for humankind is going to be over a century. It's not a crisis of 2-3 years like we are facing now. We are contracting a long-term, almost problem that's going to be very difficult to solve and very painful for both for human and for the economy and for political order. I think doesn't make any sense for Brazil to keep destroying the rainforest. Doesn't really benefit the country. And I think we have to jump in the conversation and really raise the alert right now, because the consequences of short-term deforestation can be as harmful as I mentioned about the forest fires in the summer. But we are moving towards the tipping point where the forest is gone forever. I mean, we are approaching a irreversible process to losing the forest to savanization, and then the consequences for climate change, for biodiversity, and for health can be absolutely catastrophic. And we need to address this in a very urgent manner.
Am I mute? Okay, Marcia, if we can bring you back into the conversation, maybe following this last set of remarks, and you rightly pointed out, the inventiveness, the innovation that has come out of Brazil in many fronts. If you think of public health, energy, there have been many efforts in Brazil, scientific production, technological developments, right? But Brazil has also pioneered the universal healthcare system, right? Where health is a right of the citizen, is a duty of the state, but we also know how location and region makes a big difference, in this citizenship, in this health citizenship, right? That is that's guaranteed by Brazil's democratic constitution. So I wonder if you could tell us a little bit more what you see on the ground as possible. We know about the breakdown of the system, but where there's certain initiatives over time that worked. We know that the work, for example, Beto Verissimo and colleague Tasso Azevedo and other environmentalists were able to curb the rates of deforestation in 2010, and that was a major achievement, but I wonder if you see in the domain of health and health services, any, if not success story, any resources that we might have that could be harnessed in this humanitarian crisis and this bleak scenario moving forward.
Okay, so before I talk about this, if I can just follow up on what Beto mentioned when you asked about the health piece in this story. And I think it's important to make a connection with human capital, because then economists will understand, and there's no development without human capital. So if you have horrible conditions and children cannot develop their full potential, you're harming the future human capital. If people are sick because of the burden of diseases, you have multiple episodes of malaria, you have arboviruses, you have chikungunya, severe arthralgia, you are harming human capital. So, and even now with all this discussion, let's open the country because the economy can stop. Well, if people are sick, there's no human capital to move the economy and to have development. So I think we have to start using this language that people that make the calculations of, dollar figures, whatever, they understand. So if we have a sick population, if we are basically cutting the potential of the generation being born now, living in those areas that are underserved, we are diminishing right there from the beginning. And it starts during pregnancy, okay? We are harming human capital right from there. And I think that's how we should start framing those things. It's happening already, right? And it takes generations to see the effect. That's why I like working with infectious disease. It happens now, you can see the effect immediately. But those things that takes generations, it's easy to deny because it's going to take time. And usually it takes more time than the term of politicians and power. And that's the problem. So now let me address your question. The thing is, I think Brazil has an incredible potential to have a good answer because we have SUS. And other countries envy us because we have SUS. We have the largest program of primary care in the world, the Family Health Strategy. No other country have that. Now, if you think about how can we address what's happening now, this humanitarian crisis, right? So the very first thing we should be able to do, and we are doing, and other countries have done, and we can learn from what other countries have done, as opposed to Zika that we are first. Now other countries are going through COVID, and we can learn from them. Is we know social isolation work, and a lot of people think this idea of bringing the curve down is just to save lives. It's more than this. It's to prevent a collapse of the health system. And as I gave the numbers in the beginning, the resources, both hospital resources and the health personnel, is not that good in the Amazon region. So what we're trying to do is prevent the system from collapse. Once it has collapsed, all the actions are what we call in public health the fire brigade response. You're going where the fire is burning, but you're not preventing new fires from burning. So it's like this endless process that you don't fix the issue. So let's open makeshift hospitals. Great, as long as you plan them before the system collapsed. Because honestly, can you really open a makeshift hospital with 2,000 beds? Are you going to have health personnel to work in there and provide care? Are you going to have enough protective equipment for those health personnel? So it's not just about opening the new beds, but it's having all the infrastructure to make sure those beds can be operational and then provide the necessary supply of beds for the high demand. That's one thing. Now, the other thing, which is absolutely crucial, is ideally we should be testing a lot and being able to trace the contacts of those people that are positive and isolate those positives. Okay, this is important now, and this is going to be important when we have the isolation being relaxed. Because if you just open the country, people can go out, and you don't have a testing infrastructure in place, we're going to have another wave that can be even worse than the one we're having now. Now, what is the challenge of do this, which is doing the right thing? Well, the very first one is we don't have the necessary testing capacity, period. We don't. And if there is one thing the federal government should do is build the necessary testing capacity. That's not going to be done by the states. That's not going to be done by the cities. Mayors and governors are doing the best they can to handle the epidemic, but the federal government should be trying to expand the testing capacity, because again, once those cities are opening for normal activities, we're going to need this capacity, and we don't have it. The United States doesn't have it either, but we are testing almost nothing. In some areas, the positivity is like 80%. That basically shows you're only testing the severe cases. You're not testing enough people. Now, again, if we look at SUS, we have the family health strategy teams. They know the community. They go to their houses. They know where the elderly are. They have their contacts. If we could use this network, not only to find those populations that are under higher risk, the elderly, or even if we want to call them. Here in Boston now, we have what they are calling the COVID detectives. They get all the contacts of people in the hospital. They call their family members. They try to find out everyone that was in contact with that person. Now, even if we can use our family health strategy teams to either actively try to go to the houses that they usually work, or to try to trace the contacts of people, then the question comes again, what are they going to do if we cannot test those people they find? And what we're going to do if we cannot isolate the contacts and the people that have mild symptoms? They don't have to be in the hospital. Well, they live in a very crowded household. Where are we going to put those people? And then one of the questions that I raise is, we have tons of hotels completely empty. Why can't we have, and I think this is one aspect of the public-private partnerships that Ilona was mentioning. Why can't we use the hotels and then put those people in there? So to some extent, we know things we can do, but we can't deliver them because we just don't have the capacity in place. I think a third challenge we have is, and Ilona mentioned a little bit about this, we have a lack of a uniform message coming from the different levels of the government. And that's a problem, because in a polarized society, people are going to trust whatever they want to trust, and not necessarily is the right thing from a public health point of view. And we are seeing this. It's people, they want to go back to work, and there is a huge pressure from business, from parts of the industry. And on top of this, if there is a distrust in science, then it's all a mess, honestly. And that doesn't help in trying to inform the population what should be the best actions to be taken. I think in the future, when we're over this and we're reading the history books describing what happened during this pandemic, it's going to be a story about how trajectories of the epidemic were determined by leadership, were determined by actions taken by decision makers. So I hope I get to read some of those books, but it's going to be an interesting story to tell. Yeah. And the very last thing, if I can, is which is not really so much a challenge, but I think it's an opportunity, is this is really the moment to exercise solidarity. And we are seeing some actions isolated here and there, some from the industry, some from, community organizations, but we need more of those. I mean, those actions of kindness, those actions of working for the common good, they should be spreading faster than the virus, and they're not. And I think if there is one moment in human history that is calling us to exercise solidarity, it's now. And if we don't do this, I think we're going to fail as humanity.
Yeah. So, thank you, Marcia, for this incredibly thought-provoking and inspiring notes. And I want to bring it back to Ilona. because you, Marcia, you mentioned some of the comments that Ilona made about, you know, the federal government, and then the dissonant messages coming from the question of leadership. And Ilona, you mentioned the question of political will that has to be maximized in this moment. And there are some you know, some difficult realities that are emerging, as you yourself mentioned, in the meantime, you know, as we are concerned with the immediacy of the acute dimensions of the pandemic, and one of them is the erosion also of human rights, right? And we see in the case of Brazil an increasing militarization, both of the, let's say, of the council that oversees the Amazon, but also recently the vice president, the president appointed a high-level military to oversee activities in the Ministry of Health. You know, so how do you see this militarization that is accompanying the responses to the pandemic, you know, and of the Amazon? And then after that, we want to move into the question of the visions along the line of what Marcia just mentioned, that you want to share of a possible future post-COVID-19. But the question of human rights and militarization is a crucial one that I think we want to hear a little bit more from you, Ilona.
Sure, I think, João, what we're seeing, and Marcia touched like polarization, I couldn't agree more, the different messaging, and has to do also, I think, with the issue that this government does not accept different opinions. So if the military were playing a role, as they, for example, could play in humanitarian assistance, in actually trying to help the states that cannot deal with the health capacity. So for example, the role the military played in Haiti, which is very vulnerable, you know, that would be very welcome. But what we're seeing is that, and you know, I've been working for many years with generals in the army, especially the ones that were engaged in peacekeeping missions. And so I know also that some of them are very worried. I don't think most of them support the government having the army inside, because when it's just retired generals is one thing. When the army starts to get into political question is another thing. And I just don't think it's, I would say, a uniform view, even from where we're saying. And I do worry because, you know, our country and the Amazon, we need the army to protect, to help in the borders. You know, there's so much they could be positively be playing this role. But when you see a council for the Amazon that has no scientists, has no civil society, has no indigenous groups and traditional groups from the region, so I cannot foresee that the best solutions will come up from there. And I think that is really worrying. And I just want to say that, of course, many generals and army personnel are in the government. Some of them are there trying to not allow things to go even more sideways, but many others are not liking this. And I believe that for us to think, even when we talk about Amazon 4.0, we need to bring the army to the table. And I know that many of them would be open to that, and that the federal government is a problem at the moment because these conversations cannot be public. You know, we have to hide if we want to talk, and this is not the right way in a democracy. We cannot allow this to happen. And also, I'm worried about the kind of technologies that are being implemented that will need to be implemented if we want to go into a kind of back to normal, which we know it's a new normal. Because, you know, although we are willing to be tracing and collaborating the health side, I want to make sure that a government that has authoritarian tendencies do not use these technologies also to just push even further down our, you know, human rights, our privacy, and our civic space. So I think these are very worrying issues to unpack in further events, João.
Oh, wait. Okay, Beto and Professor Vasconcelos, would you like to add something, or can we move for the final round on the vision? Or do you want to add something at this stage? Can we
Oh, that's
move?
fine.
Okay. Okay, great. So the wonderful Brazilian anthropologist Aparecida Vilaça visited Princeton a couple of months ago, and in our conversations, she emphasized the importance of drawing from indigenous perspectives and relational knowledges in rethinking science, ethics, and the political today, especially in light of planetary destruction. She's working with the idea that indigenous knowledges can be a portal of sorts, transporting us to a different here and now. We could think of the pandemic as a portal too, throwing us into an altered reality that we are all trying to find ways to come to terms with. And it will be up to us to rebuild life in this new reality, hopefully for the better, greener, more solidarious, as Marcia said, more just and equitable. So our final question to this wonderful group of panelists is about your vision for a post-COVID-19 future for Amazonia. Tell us some of the specific challenges, but also some of the specific concrete possibilities that you see in policy, in science, in economics, and development for this vital region of the planet. Who wants to start?
I can do that.
Okay.
Well, I think that it's necessary to preserve Amazon. This should be the first statement, that it's necessary for people living in the Amazon and those that don't live in knowledge the Amazon. But Amazon is too important as ecosystem, but also for the climate of planets. So it's very important to preserve Amazon and preserve the people live into the forest, the traditional indigenous people that needed to be preserved, because they have a problem with the immune system. The first, this is very important. In the past, we know that occurred during colonization, that when the indigenous enter in contact with the Portuguese, thousands of them died of measles, smallpox, tuberculosis, and so on. So this is the first important. The other is that the destruction of the forest will bring together probably desertification and difficult, therefore, to people to obtain foods and so on. In 30, together with these two scenarios, it's important to emphasize that the emergence of new viruses and that can become spread like COVID, like Zika, chikungunya, dengue, and so on. Because when we have seen the destruction of a large part of the forest, it's good to remember that arboviruses are focal. In general, almost all the viruses in the Amazon are focal distributed. So they occur just specifically in that area where it's occurred. So when we disrupt this ecosystem, the closed ecosystem, we have two possibilities. One, if the destruction of the Amazon the forest is too big and negative to the virus, they will disappear. Probably this occurred too much times that you suppose. And the other thing, if the change, the change in the forest, in the ecosystem with deforestation is positive to the virus, it will become epidemic and spread, especially if its vector is adapted to the urban areas. And you have many different vectors that can act. And just the virus needed to adapt to new hosts and the new vector. Like occurred with COVID-19, the new coronavirus that adapted from the bats to the human. And this is the same here. So it's we needed to have this in mind. And to conclude my position and my goal, I'd like to read a small sentence of Bob Shope, that was the director of the World Center for Arbovirus Research. Bob Shope and was advisor for several U.S. presidents. And in a seminar in France, in Le Pensier, he said the following: "It's safe to say that most emerging arbovirus diseases follow ecological modifications. It is naive to think that humans will stop building cities and dams, or stop entering and destroying the forests that we are discussing now. We can, however, learn more about risk and risk management, and we must continue to support environmental and health assessments, and begin to believe our scientifically based predictions and act on them." So this make it all that you needed to do to explain to the President Bolsonaro that we needed to preserve the forest, not only for the forest itself, but for the health of the people in the Amazon, in Brazil, in the world. Thank you.
Can I go next? Okay, so I'm gonna give you my vision. So what I would expect is that all of us, and when I mean all of us is the entire world, would see this, which I think it's a natural experimenting that's happening right now. We've never lived anything like this. And for those people that don't believe in climate change, that they would see the difference that it's making when cities stop, and how the air is cleaning, how, there are like dolphins in Venice, there are big turtles appearing in the Guanabara Bay in Rio. I've never seen it. I grew up in Rio. They're there. It's phenomenal. So for anybody who doesn't believe or didn't used to believe in climate change, there is a natural experiment going on showing the difference that it makes, the lifestyle that we used to have and how much that damages Earth. So my vision is that we as a humanity would learn from what's happening now, would learn the lesson that you are nothing just by yourself, that we have to work together. And I would hope that when we're over this, we would go back to a new phase of humanity where the lifestyle, the interaction of humans with the environment, and above all, the interaction of humans with each other would be different. I am afraid that when we're over this, Wall Street is going to come even more hungry and make us be much worse than we used to be with the lifestyle before. And then the damage will grow at an exponential curve. So I have a vision, and I wish we could learn from this. But, for anybody that likes history and reads history, we do a lousy job learning from history. So I want to end with a sentence from Harvey Feinberg. He was dean of the School of Public Health, was the president of the Institute of Medicine, and there was a debate yesterday organized by the school, and he said, "This won't be over anywhere until it's over everywhere. And we're only going to achieve this by working together." So I have a vision. I hope I can see this vision, but Wall Street is not making me very hopeful, but I want to be hopeful. So,
so let me take on
Yes.
Wall Street. So I just couldn't share more Marcia's vision. So before I just say my very humble vision here, which it's very much alongside. I'm sorry, but I'm going to be specific and boring with some recommendations, because I think this is important at this moment when we cannot count on the federal government. So there are legal issues that we can deal with now. So we should and be working with Congress to close legislative and investigatory gaps, because we're not, for example, imprisoning the right people, the big fish that are actually destroying the Amazon. So we need to get better into evidence, building evidence to courts and processes. And there are technological fixes that we could use for that. Second, I met a prosecutor in my last event in Princeton, Joel, and we've been discussing about what can we do. And so there will be an action by the prosecutors, federal prosecutors, to open the data, like to make it 100% public, the data of the National Environmental Land Registry in Brazil. And this data is not fully verified, and it's being used to fraud land registry, as Beto knows very well. So if we could support this claim of opening this, and then go to the banks and companies and Wall Street and say that you have to demand to triangulate this data with PRODIS or the system that satellite, or with map biomass alerts, in order to just give credit to anyone that is just developing any agribusiness or other kind of economic activities in the region. This is absolutely viable. We have the technology, we just don't have the willingness today. So as investors, as consumers, as citizens, we need to demand that. So there's so much that can be done in the financial markets, Marcia, and I'm working at Igarapé at a proposal, and we will need all the environmental groups to try to help to find early adopters for this, but to make very concrete indicators for the environmental, social, and governance indicators for financial markets, which is the ESGs, on zero deforestation, zero illegal deforestation. So there are concrete measures that I think the moment to mobilize, and I know I'm an idealist, but I'm very pragmatic. But if they don't listen to us now, we at least did our part. So there are things we can do, private sector can do, the judiciary can do, citizens can do. And I think international cooperation also. We have to be really working more on trade agreements to demand traceability and the use of these technologies. Again, it's not a problem of science or technology, it's political willingness. And if we can't mobilize now, we won't. Just to conclude, and circling back to COVID, I think that, again, trying to see this as an opportunity. We can now explain to the population this real life and intergenerational consequences of climate change, as Marcia was saying, and we cannot miss this chance. And I'll call also the partners that I know that the network of the Brazil Lab has, because we need to develop very powerful narratives and communication tools to reach to different audiences. So everything that we're proposing and everything that we need to do to just keep the forest alive and all of us will need the support of public opinion. So citizens, consumers, they need to understand why to require more transparency from companies, to pressure public agents, government leaders, and financial institutions to do their part. So I think this is very developed in the North, and we still need to gather our citizens and consumers behind this idea. So for me, the clock is ticking, and this is our chance to deliver a hospitable planet for our kids and grandkids. So let's do it.
Let's do it, but let's hear first from Beto, and then let's do it.
Okay, I think I have two kind of major things that we can do. One on the damage control side, people has mentioned, we have to really stop deforestation, forest degradation. That's the main target, and we have so many tools and policies ready to really to do this. And I think on the forest fires, we need a moratorium. The forest fire again. If you allow forest fire to happen in the summer, then the whole health issue is going to be even more catastrophic here. On the long-term vision, on the solution side, I think we have to put an agenda of social and economic development that actually values the forest and the service the forest provide to the planet, and allows to people that live in the Amazon to have a better, decent life. That's not fair to people that holds such importance in terms of old treasure, has suffering so much in terms of poverty and underdevelopment. And I think we need international cooperation, science, and also financing, because we need to move from a very high carbon emission economy that drives towards the Amazon region with a high level of poverty and crime and organized crime, a land out of law, to a territory that actually really it's protected and the future for humanity without the Amazonia. And so that's my life is dedicated to help to protect the Amazon. And I think although there's so many problems we can talk today, I think there is an opportunity with this crisis. I think that's we need to think about the narrative element as well, the interdisciplinary, as we mentioned here, and especially to bring the health dimension as a front part of our conversation of understanding. And thanks a lot, João, because that's been a wonderful seminar here. Learn a lot from my colleagues, my friends, and really inspired to have the Brazil Lab organize such kind of meeting.
Okay.
João, I just forgot
Yes,
one thing. I think it's another opportunity we have, because there is this report that will come up early next year on the scientific panel for the Amazon, which is organized by the Sustainable Development Solutions Network, convened by Jeffrey Sachs, but chaired by Professor Carlos Nobre and Andrea Encalada. And I think this will also be bringing like ultimate data. It's like the IPCC for the Amazon. So let us all unite also to make sure these findings are communicated widely and that the whole world can be touched by what needs to be done in relation to the Amazon.
Yes, wonderful. So before then concluding today's thought-provoking and inspiring event, I want to thank the viewers at home for tuning in. We hope you stay safe and keep engaging the pressing issues raised by our panelists. As they said, let's do it in our communities and in our works. We also hope you will keep participating in future Brazil Lab events. We will keep you posted. And we want to thank the wonderful Michael Mugi and Carol Dove for their incredible help organizing this event. And a heartfelt thank you to Marcia, to Ilona, to Pedro, and to Beto for your inspiring works, critical vision, and for your generosity of time and insight. Take good care.
Thank you so much.
Thank you.
Thank you.